What is ADOS to an autism diagnostic assessment? Imagine trying to understand how someone communicates and interacts without just asking them questions. Instead, you observe their actions and responses in real time. That's exactly what the Autism Diagnostic Observation Schedule, 2nd edition, or ADOS-2, is all about. It's a tool used by trained clinicians to help figure out if someone shows signs of autism spectrum disorder. This assessment looks closely at social communication, how people interact, and repetitive behaviors that are common in autism. It's not just a test you take with paper and pencil. Instead, it involves engaging with the person through activities like playing, talking, or following instructions. The clinician watches how they respond, their body language, and how they use language during these interactions. The ADOS-2 is designed for people of all ages, from toddlers to adults. It has different modules tailored to different age groups and language skills. For example, a young child who is just starting to talk might have a different set of activities than an adult who communicates well but shows other signs of autism. During the assessment, the clinician might ask the individual to play with toys, describe pictures, or follow simple commands. The goal is to see how they communicate and engage socially. The clinician takes notes on behaviors like eye contact, gestures, and how they respond to social cues. This tool is very helpful in the overall diagnostic process but is not used alone to make a diagnosis. It works best when combined with other assessments, interviews, and developmental history. The ADOS-2 provides a standardized way to observe behaviors that are key in understanding autism. It helps clinicians gather consistent, reliable information about how a person interacts and communicates. In the context of diagnosis and screening, the ADOS-2 is a key part of understanding whether someone has autism. It helps identify behaviors that might not be obvious in a regular conversation or interview. Because it involves direct observation, it offers a clear picture of how the person functions socially and communicatively. This information guides professionals in making a diagnosis and planning support or intervention. The assessment can be completed in about 45 minutes to an hour, depending on the individual. It's a flexible, structured way to see how someone behaves in social situations, which is essential for understanding autism spectrum disorder.